And that is Daniela Aguilar, and she actually goes by Danny, so I'm going to refer to her as Danny. Danny serves as part of the YWCA Yakima team for now 7 years, advocating for individuals and families experiencing domestic violence, trauma, and abuse. During this time, Danny has served as the family and children's advocate, providing support for individuals and families through emergency shelter and assistance, community education, awareness, youth outreach, housing assistance, and off-site crisis support. As of 2016, Danny transitioned her work to focus implementing youth prevention programs and community education efforts that seek to bring about change in individuals, relationships, and communities through addressing the root cause of violence, shifting culture of conversations, helping young people build positive relationship skills, and ultimately promoting healthy relationships among all people in our community. Danny is a proud first-generation graduate of Matabon Senior High School class of 2007 and graduate from WSU 2012 with a bachelor's in liberal studies and a major in sociology, human development, and a general family studies endorsement. We're super excited to have you.
Thank you, Kara, for such a nice introduction. I tried my best to keep my intro really short, but there's just been so much stuff that has happened and that I've been able to be part of that I've been really grateful. Thank you all for sharing this afternoon with us. I feel really honored to be here, but I also feel thankful to be in this safe space with you all. Again, my name is Daniela Aguilar. I use she, her, ella pronouns as my introduction. Currently, I've been really thankful to be part of the YWCA team. Again, I've been serving for 7 years. So today we're gonna talk and kind of dive into a conversation about healthy relationships. So if we can get on the first slide, I'd really appreciate it. All right, so as you can see on the screen, this mission of our team and of mine is large, and I have it in big words, and it's in a really lovely picture of nice colors, really bright. It's large again, it's possible, and it's also community driven and focused. It really involves the voice of all youth, adults, and community members. My mission today is not only to kind of get us all together and be able to know that we can create a healthy and safe future for all of our youth, but to also help you understand the power and the importance of knowing what is involved in a healthy and unhealthy relationship, and how we can be driven together as community to really provide the safe space that is so much needed right now during this time for not only young people, but also for everyone that we are around with. But of course, our main focus is gonna be young people, since you guys are our future. You guys will be the individuals that would be taking care of my kids. So it's very important. Next slide, please. So I have this opportunity to open this chat, which it looks like it's now opened. I want to do a check-in. I normally call them gut check-ins, but today I know it's going to be kind of hard to share our names. So I invite you guys to share your pronouns if that's comfortable. Let me know what has been one of your favorite food items, maybe a snack or something that you have eaten quite a bit or have learned to cook during this time of quarantine. So I'm gonna give you guys maybe a minute or a couple seconds, and then I'll see what kind of goes on to the chat, and then I'll jump in and share with you guys what I have been eating and cooking. All right, so if I'm not able to see, maybe Kara, you can help me and see if there's anything in the chat box.
Yes, there's been too much Panda Express, muffins, chicken, let's see, pambazos and lemonade, chicken tacos, apple pie. Oh, yum, this is making me hungry. Red velvet cake, go-to snack, bananas, apple pie, another one, takis, cookies, tortas, hot Cheetos with cucumbers.
Never know what's gonna be on that.
I know, that actually could be really yummy. Pizza, takis,
That's awesome. Thank you guys for participating. I have to tell you guys that I've actually have learned to do some baking myself. I've actually learned to do actually create a cheesecake and bake cookies. I know it might sound silly, but I've actually never put myself into doing any baking. But I do have to also be honest that I've been doing a lot of door dashing just because it's been convenient. And I guess it's eliminating the risk of getting myself, exposed to anybody with COVID. But yeah, I really want to try that combination with the cucumber and hot Cheetos. Sounds very interesting. Thank you guys for sharing. I see Takis, they just keep coming back. A lot of desserts and chips, yes, or chocolate chip cookies, yeah. That's awesome. Thank you guys for sharing. This kind of helps me break the ice with you guys when we're doing conversations, because I feel like they can be very intense at times. So I just wanted to make sure we can break the ice, get those off, kind of do our little shake, get into the right position so we can start learning. So we are ready for the next slide, please. All right, so just an introduction. I think with everything happening right now in our world, it's clear and obvious that we need a lot of love and we need to show a little more respect and empathy. It can be really challenging, however, at times for us to be able to practice some of these healthy behaviors whilst living in such proximity and such restrictions with others, or not being able to come into contact with individuals that we care and love for. So these next conversations of slides, I want to do an introduction to some of the most important and crucial healthy signs and unhealthy signs. I'm going to do a metaphor just to kind of relate it to, what the meaning of relationships are. And when I talk about healthy relationships, I'm not referring to them as acting on like a perfect relationship. I'm talking about one that helps show the beauty of you, helps bring up the best of you, helps you be who you are within those elements of respect, honesty, trust, and really good communication. So I hope you guys kind of take that into mind, that I'm not talking about a definition of a perfect relationship, because I think as we know it, there's no such thing as a perfect relationship. Although to us it may be perfect, but it's not labeled as a perfect relationship. So let's dig in and let's hope that we can learn and get some takeaways. All right, thank you. So here's my big idea, and this is something that in partnership with the One Love Foundation, we share when we have conversations. The idea is that 100% of us, even in this chat room, are in relationships at all times. And this is day in, day out, either through phone calls or if we do come into contact in person, we have relationships that are already built. So why not be able to be at 100% learning how to love and have relationships be better, since we're already part of those relationships? So that's the big idea. And I know it sounds like a large mission and a large goal, but I think it's doable. I'm one of those believers that 100% of that can happen. And I strongly believe that by teaching these behaviors, starting these conversations, we're gonna be able to provide and promote these conversations, promote this information that is so strongly needed, that is something that can really help you guys engage, but also learn some new skills that you guys can advocate and share with others. So strong believer, a strong preventionist. I'm here to be able to kind of give you guys this insight, again, as an introduction. So why do I share this information? Thanks for having this slide up right now. Great question, right? And why do I need to share this? Like, we see statistics, and I am a strong believer in research, and I'm a strong believer that this can change and it can get better. And like I said, strong believer at 100% that any of this kind of violence or unhealthy situations is largely preventable. And I cannot stress enough the importance of identifying some of these behaviors that could really eliminate having this number being a statistic. So for instance, nearly 1.5 million high school students nationwide have or will experience some form of physical harm from a dating partner each year. And this is by the information of Center for Disease Control, and also in part with the One Love Foundation, which is a national campaign for teen dating relationship health. The other one too is, young people are at enormous risk for more of that dating violence than any other age group. I'm talking about 16 to 23, 24-year-olds are at 3 times more likely and at a more vulnerable state to actually go through some form of physical abuse and harm in any kind of romantic dating relationship. So definitely important to note that it can affect a lot of our groups within that age group, within our young people. Just in the state of Washington, based on the youth health survey, we got to see girls being a lot more affected within these unhealthy relationships. It's not to say that men do not get affected. We do have a percentage of boys that also become part of that statistics and that are also being harmed in those relationships. So nearly 1 in 3 teens, and this is that age group that I'm talking about, the 16 to 24. It's, going on to the adult age, obviously, adolescence and going into college years. The 1 in 9 men, and this is the age group that I want to refer as adults, so 18 and over. 1 in 4 women is also a statistic of 18 and over age group. And then nearly 1 in 2 trans and non-binary people. So that is including all general individuals that fit into this category of trans and non-binary people. All right, ready for the next slide. Okay, so I do want to respect time, but I also want us to respect our space. So if we need to kind of just back up a little bit, take a breather, get some water, please do so. I know some of this topics and conversation can be really tough to kind of all take in at once. So it's important that I share that with you guys because I want you guys to feel safe. But I also want you guys to be able to express those feelings that are coming in a safe way. So how do we define relationships? And I'm just gonna go into like a general term. I like to imagine a definition of a relationship based on certain elements or certain things that can help me in metaphor of building a really good cake, a cake that is enough and healthy for me. Again, they can be defined in so many ways between one person or one or two or more people who have agreed and are comfortable to be in a relationship. It's important again to note that our relationship types can be at different levels or at different forms, like romantic, peer-to-peer, classmates, maybe teammates, within family. If they are romantic, if we are dating, those can be at different levels. But part of that metaphor that I'm using of baking a cake is my 5-tier levels within those cake, the cake ingredients per se. So I wanna include it as a reference to using the flour, using the eggs, perhaps the milk if needed, or water, the filling that you're gonna put into that cake, and then the frosting. So I wanna make that into a reference of saying that I have freedom in this relationship, that there's fairness, equality in that relationship, that there's a set goal and boundaries, physical, emotional, mental, and then there's also a level of support or also trust, and then open communication. So two of these things can fit into that filling or that ingredient that I'm referring into the cake. And we can go more into detail, but I just wanted to make sure that I can dig into a short definition. Ready for next slide. All right, so here's my diagram. Left, you're gonna see our potential 10 healthy signs. On your right side, you're gonna see the potential unhealthy relationship signs. Now, this is just to kind of present an idea. It's not to give you the exact mold that of behaviors that should be encompassed into every relationship, but I will tell you that these behaviors can be seen in all forms of relationships. So I'm not just talking about teens that are dating. I'm not just talking about friends. This can be among anyone that we come in contact and that we build on a relationship. So yes, it's overwhelming to say that unfortunately some of these signs do become present, especially on the ones on the right side that are unhealthy. But while we know that some of these unhealthy signs can be presented across all age groups, any kind of abuse does not discriminate across racial groups, socioeconomic status, gender identity, or how you identify yourself. But again, keeping that in mind that it is most harmful within the ages of 16 to 24. That's when intimate partner dating becomes at most risk and at most vulnerable. So by learning and simply understanding the meaning of these listed behaviors, and really just overall acknowledging that relationships are not all perfect, I think it gives us a good way to start conversation, but also help to promote you to be in good relationships that we all deserve, especially with respect, honesty, and communication. All right, so let's dig into some of these signs. Next slide, please. All right, so I'm gonna do a relation with each sign identified here on the slide in relationship to how we are going through these signs during this COVID and pandemic. So I'm gonna start with comfortable space. So this is one of the behavior that you might see or might be shown in a healthy relationship. So in this comfortable space, I wanna be able to have two individuals that are in that relationship or self, giving everyone or that self person patience and space to adjust to what we are now calling the new normal. So including yourself and not feeling pressure to see or move with a partner if you're not comfortable doing that. So is to say an example, if you're feeling like this is moving too fast, like we just started talking, maybe I'm not ready to date, or put that into official togetherness. So being at that comfortable pace that we're both on the same page. Honesty, really being open and candid about your feelings, and know that it's okay to share those feelings and your needs and your wants during that time, as well as setting those boundaries, like again, mental, physical, verbal, instead of letting them kind of simmer and really just like overwhelm you or stress you out, where you just get to a point where they just kind of explode, right? Respect. So really showing respect to digital boundaries right now, just because we're coming into a lot more contact in a digital platform. So just making sure that we can allow ourselves to give space away from being into digital contact, and knowing that we can both respect that if we are choosing to have that be done. Like today I may not be able to FaceTime, or today I'm gonna be off my phone and going on for a walk, or things like that, as an example. The next one that we have on the list, I just lost my notes there, is kindness. So kind of doing small things, like thoughtful acts, especially right now. If I get to send you something in the mail, or perhaps I can DoorDash you a meal, just kind of doing some of those things daily, or checking in. It's like, hey, how are we feeling today? You know, what are your plans today? Doing a small check-in where you're not feeling like somebody's trying to control your daily routines. And then providing a healthy conflict space. So openly and respectfully being able to discuss issues or things that are bothering you, and being able to do it in a way that you're not attacking or confronting that person, but also taking the time to do it at a safe space and at the right time. All right, next slide. All right, so our next 5 signs, we kind of went through the first 5. The next ones would be trust. So when I say trust is really sharing, and yes, please make sure to put in any questions on the Q&A. That way we can get to them after we go through this conversation. So especially right now with the trust, we want to make sure that anybody that you're in a relationship with is able to confide with you if they have been exposed to COVID, or if they have experienced symptoms of COVID. That way, if you need to kind of give yourself some space, that you're able to do that, and you're not putting anybody at risk. So being able to confide to that partner, whatever is happening during that time. Independence, so really having the space outside of the relationship. I think right now we're able to do that, hopefully in a healthy way, setting aside time for your own independent new activities or new hobbies that you might be doing, like reading or perhaps journaling a lot more, exercising from home and not being able to go to the gym, doing a lot more self-care internally, mentally, maybe spending more time doing FaceTime with mom rather than doing 24/7 with boyfriend. So kind of having that space to do so and knowing that it's your right. Equality, sharing common time safely. If it's at your own household, you know, it's kind of setting some time aside where you're doing that, or presenting that virtual form. Like maybe we're having virtual dates on Thursdays, and that's the only day during the week that we can do that. Other than that, we'll be texting, or perhaps there's a call, but we're not virtually face-to-face seeing each other. And we're doing that at an equal space. Taking responsibility, being able to acknowledge your own feelings of stress, feelings of anxiety, fears of safety or exposure at this time for COVID. And then lastly, on the healthy science is fun, being able to enjoy that Even if it's a lighthearted activity, it being like a board game or safely doing like a group one chat game that I actually got to do with my family. We got to play one Uno on a virtual platform, which was kind of fun. Just being able to still do that while still being part of that relationship. All right, next slide, please. All right, and please do let me know in the text for host how I'm doing on time. So for the unhealthy relationships, I want to start with the word intensity. So this is going to look like, especially right now during COVID. On the screen, you're going to see general definition, but I'm going to elaborate more onto the COVID experience right now. So this intense level of behavior can be expectations that are highly to be met. So the other person doesn't get mad or upset. If you're not responding quickly, or if you're not answering my calls or texts, or asking you who you're with and what you're doing, if you are home, those sorts of things. Manipulation, so when someone is really using the shelter space to prevent someone from leaving, or using the social distance restrictions to not let you pretty much go grocery shop or accept your DoorDash. Sabotaging, when someone purposely is exposing you to COVID, or you're not at that trust level where they're able to let you know that that you're being exposed, or withholding any essentials that you need, like the sanitizer, the wipes, or the Lysol spray. Guilting right now, making someone feel bad for having conversations about boundary setting, or your shared living space, shared FaceTime, expecting someone to be okay with sending explicit photos, or photos that are making you feel comfortable, or things that you did not want to send to that person, or guilting you for not making time for them is another form of guilt. Deflecting responsibility. So I think I've seen that a lot right now with adults. I haven't seen much situations with young people, but using current situation as an excuse for kind of sharing those unhealthy behaviors, like the yelling, the putting down, the blaming, situations that are not going well for that person on you, or because of stress, or blaming you for possibly being unfaithful, that now you're on virtual platforms and I don't know what you're doing on there. Are you chatting with people that you're not supposed to? Are you selling things that you shouldn't be selling? Are you coming into contact with people that are being exposed? And again, deflecting that responsibility on you.
Danny, this is your 5-minute warning.
Thank you, Kara. All right, next slide. We're almost there. All right, and these are the last 5 signs that I wanted to talk to you guys on the unhealthy side. So that's right side of the diagram that we showed. Possessiveness, so this can be, and again, these are examples being used during the COVID situation. Perhaps demanding that someone shares their location at all times, or has the location enabled at all times so they know where you're at. Perhaps they have demanded that you share passwords with social media platforms so they can see who you're coming in contact with while you guys are both in quarantine. So very much a possession of what is your choice and what is your privacy. Isolation, pressuring someone into quarantine with them instead of family or friends. So this can be an isolation physically, but also verbally and emotionally amongst people that are a big support to you. Belittling, big word, putting someone down for their work habits, your interests, your needs, wants, what you're snacking, choices that you're making as far as what you wear or who you talk to, especially during quarantine right now. Degrading insults, you look fat, you've gained weight, why are you wearing makeup, who are you trying to impress? And this could be during FaceTime, or if you guys are coming into contact physically, that could also be seen. Just really limiting any interaction with others, and it's just being with that person or that individual. Volatility, so change of moods, swinging moods, flashing out one day and the next day they might be really understanding. And this could be with text messages or calls. Not being able to leave the house can be an extreme change of mood where physically you were allowed to and now you're not. Or simply also taking your phone away for no reason, which I think that can become a very abusive and much more of a controlling behavior than unhealthy. And then last one is betrayal. So exposing others in your living space to COVID-19 by not taking proper precautions. So this could be the individuals that are in no belief of this pandemic actually happening and just not really being honest and sharing who they're coming into interaction with or who they're being exposed to because of COVID. Next slide. All right, so now that we've taken all this information, all of it, and believe me, I know it's a lot. I understand it's gonna take some time to kind of let it all sink in. I want us to really just take a deep breath. I want you guys to kind of take this and experience as, well, take this question on there and feel free to put it in the chat if you like. Otherwise, kind of take a screenshot of the picture of the healthy signs and unhealthy signs and kind of journal it or, you know, write it down at home, maybe share it with a family member or someone that you can safely do that to start a conversation. And it could be helpful to take that question home, or if you guys are open to do that here in the next couple seconds, it's open to all of us here. So what is one of the signs that you've experienced, or you could say honestly you've experienced, and it can be both from healthy and unhealthy signs, or if you feel like you've been experiencing more than one sign, feel free to share. And anonymously, if you guys want to do that, or in private, that can also be an option. So yes, consider that while you guys are also taking care of yourself, because this can be a very intense question to kind of deep through and go through that. So yeah, it could be an option to take that home. Don't consider it a homework, but more of like maybe a journal prompt or a conversation starter. All right, so if you guys want to take a screenshot, feel free. Give you guys a couple more seconds, and then I'll ask our moderator to change the slide. Okay, go ahead and change the slide for me. All right, so today, as my closing, I want to challenge you guys to kind of practice some healthy mental health activities that can help you in relationship to healthy and unhealthy signs. More of the healthy signs, to be honest. These are just kind of some things in practice. If you can go on to the next slide, I want to make sure I can just give one example briefly. So I'm challenging you guys in a sheet that has 5 weeks actually, where you guys can do 2 signs per week, where you guys can practice some activities. So like for the first sign that we talked about in the healthy sign, comfortable space. So intentional relaxation would be an activity. So this could be like dedicating a whole afternoon to relaxing, napping, maybe watching TV, and knowing that it's okay to take it slow and be gentle with yourself. This could even be intentional relaxation, where we turn off our phones as an activity to be challenged. And then in a sign of trust, maybe trying something new and trusting that it will be okay. And just knowing that it's okay is okay. Start a new activity, so a new sport. I know we have restrictions to going outside, but if we learn something maybe at home, I don't know, it could be like a dodgeball if you guys have a garage or doing something like that. That, you know, helps you really feel better that you're learning and gaining a new hobby, and that it's your right to be able to do that, especially during this quarantine when we're kind of like stuck at one space. I can see that becoming very much like stressful and like put you into this mood where you have no motivation to do anything else. All right, so you can leave up the next slide. So there's going to be a handout with the healthy signs and a PDF, hopefully send you guys. And then this list of activities that I challenge you guys to practice. You know, the goal is to work on one of them per week if you guys want to take that challenge on. And then just share with me on social media, which we have a Facebook and Instagram, or you guys have my contact email that would be shared, where you guys can kind of tell me like some feedback, how that went for you, and if it was something that you really liked and enjoyed, or maybe shared with someone. All right, so next we'll just go into our questions. Do we have any questions? And yes, our national resources, of course.
Hi, everyone. My name is Lanny Abundiz, and my coworker's name is Rusila Santiago Sanchez. And we are legal and community advocates. There we go. We are legal and community advocates, and we also work with the Youth Homelessness Demonstration Program. Next slide, please. We are from New Hope, and our office is located in Moses Lake. Next slide, please.
Sorry, I accidentally tried to send you an email, so I'm going to relaunch that. Apologies.
It's okay. Perfect, thank you. So our office is in Moses Lake, and we are the New Hope office. Next slide, please. And our mission is connect the survivors to restore justice and provide hope. Unite with communities to build and strengthen allies so together we can make our world a safer place. Next slide, please. We serve victims of domestic violence, sexual assault, and victims of crime in their families, and we also have forensic interviews for kids. So domestic violence, we don't only serve people that are in a legal marriage, or we also serve people that are in a dating relationship, and abuse between family members. That could be a cousin, that could be a brother, that could be with parents. We serve all different types of domestic violence, and not only physical, but also mental and emotional. And we also serve sexual assault victims from all ages. We have our Child Advocacy Center where we see our younger kids there. Next slide, please.
Hi, my name is Rusila. So Lanny and I were, as she mentioned, we are part of the New Hope agency. And so we serve the Grant and Adams County. We do have offices in Othello, Ritzville, Royal City, Mattawa, and Grand Coulee, and even in Quincy. I know we're working on getting an office in Ephrata. And so we have, outstations. So there's certain days that we go out in these areas. So if you ever have any questions, you can always call our office and see when we are in your area. Next slide, please. Okay, so I wanted to share with you guys about our youth homelessness demonstration project, also known as YHDP. So Lanny and I are the only two advocates in our agency that does this hybrid position. So we help homeless youth that are ages between 12 and 24, and we provide only support services. So that means that, we are basically like mentors for those that are going through this experience, this scary experience, because, there's a lot of times that they don't know what's going to happen to them next. And we've had clients that sleep in the park or that sleep in a car, just to find shelter. And so what we do is that we, walk with you or whoever is going through that experience, providing that support. So a lot of the times we will provide the information, we will do explanations as far as like what services are available. And, if you haven't applied for different services like food stamps, then we walk with you through that. And we support you and we tell you how things happen as an adult and like what the questions are going to be asked about you, and just kind of giving you a lot of information and feedback and just being that support system. Next slide, please. So like I said earlier, we do help those that are between 12 and 24. So a lot of our clients recently, we have had clients in Quincy and Royal City and in Moses Lake. There's areas that we're still working on trying to get folks to learn about our program, and also, connecting them with the resources that are available to them. We do safety plan as well, and we are helping out with any legal services that may come your way. And we do try to work with you as far as like what you can legally do. So it can look differently depending on your age as well. Just keep in mind that, 12 through 18, that's, you're considered a minor, you are a minor, so things that look differently for you. And for those that are 18 and 24, there's, that also looks different. And also just to let you guys know, because we are an agency that helps with DV, We also are able to provide, clothing, food, and hygiene because we get donations through our communities. And so with these type of items, we're able to give out to those that are, in host homes or, in a park, or that just need that basic needs. Yeah, so next slide, please. Yeah, and if you guys have any questions, please feel free to call our office. I'll repeat the number again. It's 509-764-8402. And you can always ask for Lanny or Rusila. We're the only two that work with the homeless youth. And if you don't know whether you qualify or your friend qualifies, call us, ask us these questions, and we will walk with you, and we'll make sure that you get the support that you need. And just, I know it can be a little bit scary, but we're here to support you guys, and just so that you guys know that you have this support in the community as well.